good? All systems go. Whoops. Okay. It is Wednesday, February 26, 2020 at 5:37 p.m. The Central Health Board of Managers meeting is in the manager's room, 1111 East Cesar Chavez Street, Austin, Texas 78702. We are in the boardroom of the Central Health Administrative Offices, and we have come to order. So the first we have before us to begin with, the first item of business.
Thank you, Chair. My name is Ivan Davila, Director of Communications and Community Engagement at Central Health. We have no one signed up for citizens communication.
Okay, so seeing as we have no one signed up for citizens communication, we will move on to the consent agenda. Is there a motion? Yes.
I move that the board approve the consent agenda items C1 through C7.
Is there a second?
Second.
Okay. Any discussion? All in favor, say aye.
Aye.
Opposed, same sign. Any abstaining? One abstaining. So show Manager Jones abstaining. The consent agenda, we have one abstaining. That's reflected, thank you. All right. So we will now move to the regular agenda. Item number 1, discuss and take appropriate action on the formation of the Central Health Medical Executive Board. We have Jonathan Morgan and Monica Crowley here to present. Thank you for being here with us.
Good evening. Good evening, managers. I'm John Morgan, the Chief Operating Officer for Central Health. I'm joined by Monica Crowley, our Chief Strategy and Planning Officer. Tonight, I'd like to start with just calling your attention to the presentation and a resolution, a draft resolution that's been included in your backup materials in your packet for this evening. We are asking this evening for the board to take action to establish the Medical Executive Board for Central Health. This has been a work in progress for at least 2 years, leading up to the last legislative session. As you all likely recall, we sponsored some legislation to allow Central Health to hire physicians and directly practice medicine, and this is our next big step in that direction. Just as a little bit of background, as I mentioned, Senate Bill 1142 in the last legislative session authorized Central Health to directly employ physicians and practice medicine to meet the needs for the efficient operation of the district. Previously, Central Health could only employ physicians and practice medicine through Community Care, our affiliate FQHC. Senate Bill 1142 also is really to meet the needs that are specified by the Texas Medical Board to protect the independent medical judgment of our physicians. And that statute specifically prohibits the Central Health Board directly controlling or supervising the practice of medicine. And as you all know, Central Health is authorized in its bylaws to appoint non-board members to its committees to assist the district. And we'll be asking the board to do so as part of that resolution at the end. It's important to note that the legislation or the statute requires the Medical Executive Board to establish certain policies, and we've outlined those here. This is very similar to what other healthcare districts or other hospital districts around the state, what their structure looks like and the types of policies that they have in place. We've had some other structures historically in Central Health and also in the Community Care Collaborative that have had similar roles and functions, but this is really what we're evolving to in the district. For example, we've done network credentialing for our contracted providers historically. We've had quality assurance and quality review activities that have existed previously. But these are the required policies, and in the resolution that you'll see in your packet, one of the items that we're asking the board to do is to direct the medical executive board to establish these policies over the coming months. In addition, the statute requires that we create a conflict management process, a conflict resolution process between the Central Health Board and the Medical Executive Board. A good example of that is, this Medical Executive Board won't have budget authority. It won't have the ability to spend. And from the Medical Executive Board's perspective, they could decide that they think we should offer a new treatment, cover a procedure that we haven't previously, establish a certain credentialing rule around the employment of our physicians, and we need a process between the Medical Executive Board and the Board of Managers to resolve those issues. So if the Medical Executive Board decides there's a new treatment available for our patients and we don't have funding for it, we need a mechanism for the Medical Executive Board to make those recommendations to you all. There are also requirements for the members of the Medical Executive Board to disclose any financial conflicts that they may have. The next two slides go into a little more detail in terms of the structure of the Medical Executive Board itself and how it interacts with the Central Health Board of Managers. So as you can see on the left-hand column, the Central Health Board is responsible for establishing the Medical Executive Board itself and directing the Medical Executive Board to perform the functions and set up the policies that are required by statute. The Central Health Board will also receive reports from the Medical Executive Board, and I need to draw a distinction here that there's a portion of this work that needs to be conducted in a privileged or confidential setting. And that's really where we're talking about individual patient data or individual provider data. That could be due to a credentialing decision, that could be due to a quality of care issue, a bad outcome on a patient case, and when we have those types of things that the Medical Executive Board needs to report out on, they can do that to the Central Health Board with the Central Health Board meeting as a medical committee. I think that the Central Health Board also has the option of establishing a medical committee, and I think our recommendation is that we likely will need to do so probably in the next 12 to 24 months. But at this point in time, there's a lot of work that needs to be done in this Medical Executive Board structure to establish those policies and get the meetings and committees running before we have a lot of business that really needs to be conducted between the board and the Medical Executive Board. The other piece that I'd like to call out is, our intention is to be as transparent as possible with data related to quality of care for our patients. So anytime we're talking about aggregate level quality data, data that doesn't involve PHI, that type of data will be reported outside of this committee structure so that it's in an open environment, it's in our public meetings, and we're being as transparent as possible. The other thing that will happen outside of the Medical Executive Board is services planning. So the information that's reviewed in the medical committee, the Medical Executive Board structure will be privileged. The members of that Medical Executive Board can take their insights and knowledge about that information and use it to inform our clinical services planning. For the Medical Executive Board itself, inside of that practice of medicine box, there's really two different aspects that we're pulling into this structure. The aspect that's required by statute is the portion on the left, or what we're calling the direct practice of medicine. Today, for your awareness, that's a very, very limited scope. We today employ one physician outside of community care that really works in an administrative function. So the initial steps here are gonna be, setting up the policies, setting up these committee structures, and then our next step is putting in place the policies and protocols that allow our existing clinical professionals to work to the top of their license. So that, the one physician that we employ today is Dr. Jim Brown. His work today is focused on overseeing our post-acute care program, our medical management programs, and informing our clinical services planning. Dr. Brown can't write a prescription on behalf of Central Health. So if he encounters a patient that needs a prescription to hold him over the weekend, he can't do that today. But through this structure, we hope to be able to do that. Another really common example, our case managers, our nurses, are in our patients' homes working with them and helping them navigate the system on a daily basis. They can't change a wound dressing. So through this structure, we'll be able to put standing orders in place and allow the folks that we already employ to work to the top of their license and better care for our patients. On the right side of that diagram is what we've called the network practice of medicine. Those are a lot of the activities that have previously been done in the community care collaborative, things like managing our pharmacy formulary and our network pharmacy, credentialing our contracted providers, and having network clinical quality oversight. The committee structure itself will mirror the required policies from the statute, and the medical executive board will also have the ability to establish ad hoc committees to look at specific issues. Most of those ad hoc committees would likely live in that quality assurance space if we want to look at quality outcomes in a particular type of cancer across our patient population, but looking at that patient level data, looking at healthcare for our homeless patients, and really diving in deep at the individual patient level to make sure that we're getting the level of outcomes that we want. We could also have ad hoc committees at the pharmacy level, for example, that look at new treatments and new prescriptions that are available for our patients, or look at ways that we can better develop protocols to apply those different drugs. And finally, on our next steps, this is a pretty complicated resolution that you have in your packet. I'll highlight what I think are the most important aspects of it. So first, we're asking that the board adopt a resolution that establishes the medical executive board itself. Importantly, we think that our clinical staff here at Central Health should resemble the patient population that we serve. So our second bullet really speaks to a proactive stance that we're asking the board to take regarding the diversity of our medical executive board. That's diversity in two regards: their personal backgrounds and also their clinical expertise. We don't want a medical executive board that's made up of only primary care physicians or only hospitalists or only cardiologists. We'd like a broad array of patients, and again, a broad array of clinical expertise and a physician staff that reflects the community that we serve. Third, we're asking that the Central Health Board appoint Central Health's Chief Medical Officer and Associate Chief Medical Officer as the Chair and Vice Chair of the Medical Executive Board, respectively. As you all are likely aware, today we do not have a Chief Medical Officer. So we're actually in the process right now of working with Community Care to have Dr. Shalsha work in an acting capacity as our Chief Medical Officer to help get this work underway, stand up the committee structure, and help us really evaluate what we're going to need from a staffing standpoint. And finally, we need the Central Health Board to direct the Medical Executive Board appointees to develop the policies and processes that are required in the statute. I said a lot there. Monica, anything you'd like to point out? We're happy to take any questions. Thank you for your time.
Thank you for that, very thorough. And I know there was legislation that passed in the last session, right?
Yes, ma'am.
That deals with, and Manager Jones, I know this is something we've discussed, with the practice of medicine and given that legislation, this is something that we must do, correct?
This is the next step, yes,
This is
ma'am.
the next step, okay. We'll start with questions, Manager Valadez?
Not a question, but in order to have questions, I would like to entertain a motion.
Wonderful, thank you.
And I'd like to move that the board adopt a resolution that Mike Peaceman, our CEO, will read into the record to create the Central Health Medical Executive Board.
It's not a short one.
Okay.
Do I get a second?
A second.
So we have a motion by Manager Valdez, we have a second by Manager Bell, and Mr. Giesland will now read the wording, and then if there are any questions, thank you.
Resolution of the Travis County Healthcare District doing business as Central Health Board of Managers to form a medical executive board. Whereas the Central Health Board of Managers, parenthetically the board, is continually seeking to improve the quality of medical aid, care, and services it offers to the indigent and needy residents of Travis County. And whereas the 86th Texas Legislature passed and the governor signed into law Senate Bill 1142, now codified as Section 281.02815 of the Texas Health and Safety Code, which authorizes the board to appoint, contract for, or employ physicians whenever the board deems such action necessary to provide medical care to such residents. And whereas the Central Health Board of Managers believes it is necessary for the efficient operation of the district to appoint or employ physicians who are reflective of the residents it serves and who have broad subject matter expertise. And whereas Section 281.02815 strictly prohibits the board from supervising or controlling the practice of medicine and requires any physician employed by Central Health to report to the chair of a medical executive board. And whereas 281.02815 prescribes the establishment of a medical executive board that will adopt, maintain, and enforce certain rules, policies, and implement disclosure and reporting conventions. And now therefore be it resolved that on this date, the Central Health Board of Managers hereby creates the Central Health Medical Executive Board and delegates to the Central Health President and CEO the authority to appoint, contract for, or employ physicians under Section 281.02815. Be it further resolved that the Medical Executive Board is created to promulgate and adopt, maintain, and enforce policies to ensure that a physician employed by Central Health exercises the physician's independent medical judgment in providing care to patients. Be it further resolved that to emphasize the prohibition contained in Section 281.02815 and Title III of the Occupations Code on the board's supervision or control of the practice of medicine, the board will amend its bylaws to explicitly recognize this prohibition and will develop and implement a conflict management process jointly with the Medical Executive Board. Be it further resolved that among the policies the Medical Executive Board is charged with adopting, maintaining, and enforcing are policies relating to 1. Governance of the Medical Executive Board, 2. Credentialing, 3. Quality assurance, 4. Utilization review, 5. Peer review, 6. Medical decision-making, and 7. Due process. Be it further resolved that the Central Health Board hereby appoints Central Health's Chief Medical Officer and Associate Chief Medical Officer to the Medical Executive Board as the Chair and Vice Chair, respectively. Be it further resolved that the Chief Medical Officer and the Associate Medical Officer shall be licensed to practice medicine in the state of Texas and shall at all times serve in their respective capacities as officers of the Medical Executive Board. Be it further resolved that the Medical Executive Board may elect additional officers or members who are employees of Central Health and currently licensed to practice medicine in the state of Texas. Be it further resolved that the Medical Executive Board is charged with recruiting and maintaining a diverse physician staff and Medical Executive Board membership that reflects the community of patients we serve. And be it further resolved that the Medical Executive Board may engage non-employed physicians and other clinical professionals who have specific subject matter expertise to serve on any committees the Medical Executive Board forms to perform the functions of the Medical Executive Board. If adopted, this day, present day, 2020, by the Central Health Board of Managers, to be signed by the chairperson.
Thank you, Mr. Giesland. Any questions or comments, member? Okay. Yes, Manager Jones.
Yeah, I have several. First of all, thanks very much for this. It's very helpful. The first question is, in terms of, look at the org chart, and it's a dotted line between the Central Health Medical Executive Board and this board. Legally, though, if we have legal action against that board, how does that manifest itself in terms of the board's responsibility and accountability?
Holly, you can speak to that.
I will do my very best. I think that's a great question. I will give an example. If a member of the medical executive, if the medical executive board credentials a physician who ultimately results in providing care to a patient and that patient has an adverse outcome, the Central Health Board would not be liable for that patient care that was rendered by a physician credentialed by the Central Health Medical Executive Board. That's just one example. I think you're asking a broader question that I don't have all the answers to today.
No, well, you asked the specific one I was trying to get in. I appreciate that very much, but I do think there are some larger questions in terms of legality. Which brings me to my second question is, can a current Central Health Board member, who is an MD, of which we have two, serve in the capacity as chair of the Medical Executive Board and as a member of the Board of Managers?
I'll have to let Holly answer the question of whether that's possible. I don't think it is advised. The intent of the statute is to meet the requirements that the Texas Medical Board puts in place that separates medical decision-making from administrative. So I think the more crossover or interaction there is between the Central Health Board and the Medical Executive Board, the less independent the actions of the Medical Executive Board look.
Mr. Giza, do
But-
you want to further address that?
Actually, well said, but it also is in part answer to your first question as well. I mean, that's one way that you maintain that firewall.
Right, but I guess my question is there anything in statute that prohibits that?
Not that I'm aware of, Holly.
So the chapter of the Health and Safety Code that allows us to form a medical executive board does not expressly prohibit a member of the Central Health Board from serving on the Medical Executive Board. But because that Medical Executive Board is supervising the practice of medicine by physicians, I would strongly recommend that anyone appointed to that board be a physician.
And
Right.
I think that it is, if you think about best practice and what's common practice, it's common practice that the doctors that are employed by an organization make up the members of the medical executive board. And like John mentioned, there can be ex officio members who are nurses, other types of service providers and subject matter experts. But when you're looking at controlling and supervising the actual day-to-day practice of medicine by the people that are providing care in your practice, I think the best practice is to have the doctors that are actually employed by that practice making those decisions and not, outside.
Well, implicit in my
doctors.
question is that point. I'm agreeing with all of this. I'm not opposing. I just want to make sure I'm clear because I can see down the road a different board, a different chair, or a different whatever could
Right.
come in and say, well, I'd like to serve as chair of this committee. And if there's nothing that prohibits it, even though the practice may be not to do it, that doesn't imply that it won't happen. So and then my last question relates to other healthcare district, hospital district. You said this is a practice in other ones. Do you have examples of, so each of the hospital districts in the state of Texas have a health, has a medical,
Our legislation was modeled off of other healthcare districts in Texas, yes.
and the interaction between their board of managers and their,
I can't speak to that level of detail, I'm sorry.
I will just add to what John was saying, that there are at least 4 other hospital districts who operate pursuant to a medical executive board structure. I was not responsible for looking at other hospital districts or dotted line relationship, but this would be consistent with how I understand medical executive boards report in larger hospital systems.
well, my only concern with this is that before we go ahead, I mean, obviously it's the board's decision to go ahead and accept it, but I would think it would be prudent for us to at least examine what has been the practice in the other 4 districts where they have this. Because I can foresee down the line, there's some crossing of responsibility, expectation, and role expectations. Even though we spell it out here, it still has a lot of gray areas in here of what can occur. And so it would be helpful, I think, if we could see what has happened in the other hospital districts within Texas where this exists. So those are my questions.
Valdez, you had a question?
No, I thank you for raising your concerns, Manager Jones, and as far as I could tell, that would be more reason to not have the board members serving on a medical executive committee, because you want them to maintain that distance, and if anything were to happen, again, for liability purposes, you don't want the board of Central Health to be involved because we credentialed our own manager credentialed a visit. That, to me, that's a conflict situation, just the way I look at it, but.
I was not requesting that. I was just asking the question, is that possible?
Oh, okay.
Yes.
I can tell you for a
Manager
fact,
Jones.
and I know several physicians who are on these boards in the other districts, the other hospital districts, and they feel like it's working fine. I know physicians are on the other hospital districts.
Well, I'm not questioning it. I'm just saying that we find ourselves down the road. I think these questions would be prudent to have asked and addressed before we rushed in, and that's the reason I raised it. It's obviously the board's decision, but.
But it does work, because I know physicians who are on the executive meetings.
Anything?
And Manager Jones, not speaking to what's legally possible, but I would point out that the operational tempo of this type of structure is pretty demanding. Most, we're very, very early in this, but most more mature medical committees and medical executive boards are having at least monthly meetings and committee meetings, board meetings and committee meetings, if not more frequently. Some have, as much as a committee meeting a week. So I would want the board to be aware of that before we ask a board member to commit that level of time. This is a very operational type of body.
Okay, I appreciate that.
Yes, sir.
But maybe my questions are not phrased well. I'm not advocating that we have a.
I'm just raising,
I'm just raising the question so that, should that question occur for another board, I am supportive of this. I think this is very well. I just think it would be very helpful if we had some history or some reference to other districts before we go ahead and approve this recommendation.
Yes, Mr. Gason?
And first, if I may, Madam Chair, in trying to respond to Manager Jones's questions, I need to direct a question to staff and council. But under the resolving clause related to the medical executive board establishing policies related to, and it lists 7 items, starting with governance and then ending with due process. Within the scope of each one of those policies, can we address some of these issues that are being raised tonight? So, for example, potentially interference from board member physicians, if that should ever arise, and then again, some of the other concerns that Manager Jones has raised.
I think there is an opportunity to address some of these questions in those policies, and I would also point out there's a resolution to also update the central health bylaws
That's right.
to align with the statute and to specifically prohibit the board's direct involvement in the practice of medicine.
So let me ask a question, and because I noted that, and we have an agenda item later
Yes, ma'am.
on the agenda to create a ad hoc committee that could take care of those kinds of things, but I saw that on there, and so to me, when you say the board interfering, to me, appointing a board member would in fact do that.
And that's why this has been structured as,
Yeah.
again, the Central Health Board can meet as a medical committee, or we can establish a separate medical committee of the Central Health Board that can receive reports and.
Right,
And.
but that's
and
not
vet-
what this is.
That is correct, so.
If I may, Madam Chair.
Yes,
And so-
Mr. Giesel.
And then to close out the response on this, I think within the work of defining those 7 policy categories, we can certainly reach out to these other 4 hospital districts and bring in that knowledge base, if you will, to be able to inform this. And that's something that, we come back and report to the board on the work of this particular executive committee. We can certainly highlight and surface those lessons learned and explain why we've done what we've done based on what these other hospital districts are. So I think there's a mechanism in here to do
But we're being asked tonight to adopt this, if I'm correct.
We are, and is there a time issue with the creation of?
This is work that needs to be done. There's a lot of work to be done, and delaying the establishment of the medical executive board delays that underlying work.
Delays the ability to commence
Yes,
the
ma'am.
underlying work.
Yes, ma'am.
And this is something that in the future, you mentioned 12 months from now, we may need a different structure. So this is something that at any time could come back before the board, right?
Absolutely.
For amendments. So if in devising these policies such as governance, you saw that there needed to be changes that could come back before this board, correct? And if the board has some changes it must make in its bylaws, given this, but could even make additional changes in its own bylaws. So to me, if the board of managers wanted to say in its own bylaws that a member of the board could not serve on this, the board could do that in its own bylaws.
And we can bring that information to the bylaws committee if
Right.
it's useful.
And so that could be addressed there.
Well, as I say, I'm not opposed to
No,
this.
no.
My only concern is that if we have a history, or we have some documentation or some information that has
Right.
occurred in the other 4 districts, it would be helpful to say, in, I don't know, Parkland, that they seem to have issues related to this in terms of interaction.
Right.
That's all I'm asking,
So I think that those are extremely relevant points that you've made, and would ask that the committee, in looking at its governance and peer review and all these, look to what these other districts have done, as Manager Jones noted. And I would ask that when we have, if we have an ad hoc bylaws and policies committee created, that committee will then need to look at any changes that must be made to our bylaws, or that others, if there are any others, that members would want made. Anything else? Okay. So we have a motion and a second. All in favor? Aye. Opposed, same sign. Any abstaining? Okay, seeing none, the motion passes.
Thank you, Manager.
Thank you. Okay, so item number 2 is discuss and take appropriate action to merge the ad hoc policy and the ad hoc bylaws committees into a single committee called the Ad Hoc Policy and Bylaws Committee. So the bylaws of the Central Health Board state that the chair of the board can create ad hoc committees. And as a matter of fact, previous chairs have created ad hoc committees. And so we have an ad hoc policy review committee that was formed by the prior chair in 2019 for specific purpose. And then we have also an ad hoc bylaws committee that was formed in 2019 by the prior chair for a specific purpose. So what I would like to see here is that we merge those two into one committee that would be named the Ad Hoc Bylaws and Policy Committee. And that particular Ad Hoc Bylaws and Policy Committee going forward have responsibilities to include the review of non-financial policies and procedures and bylaws changes, and be responsible for gathering all information necessary to draft bylaw changes and update non-financial policies, and make recommendations as necessary too. That is what we have before us. And we did just hear, for instance, about an issue that would have to come before some type of committee to make changes in the bylaws. So if it is the desire of the board to create this, then that is an issue that, for instance, would come before this ad hoc committee. Do we have a motion?
I'd like to move that the board merge the ad hoc policy review and bylaws committees into a single committee. Did you want to make any appointments, or do I need to make this an action item first?
I think you can,
I think it would be very helpful for you to name the members that Manager Greenberg has already spoken to, which is in your motion, because right now
Right.
you have two committees with different members, and
Okay.
they would all be on it without.
exactly.
Okay, and that committee would include Chairperson Greenberg, myself, and Manager Shannon Jones.
Right, and the chair of that committee would be Manager Valadez. Who is also the
Yes.
secretary of our board.
Second?
Second by Manager Oliver. Any further discussion or questions or comments on this item? Okay, hearing none, all in favor? Aye. Opposed, same sign. Any abstaining? The motion passes. Thank you, members. Okay, we will move on to our next item on our agenda, which is item number 3, discussion of the Executive Committee's instructions to the Ad-Hoc Bylaws and Policy Committee and the Ad-Hoc Women's Health Committee on subject matter and scope, and provide an update on subject matter and scope of the Strategic Planning Committee's Eastern Crescent Subcommittee. So we have now approved the Ad-Hoc Bylaws and Policy Committee, and I think there are just some items that I'd like to, enumerate and see if there's any discussion on that. I would hope that this, now that this committee's been created, it has a chair, it has members, that it could meet as soon as possible to address some pressing matters, one of which was just addressed in this resolution for the Medical Executive Committee, but others would be any changes that we need, according to work of staff and attorneys, to update the list of standing committees, right? Under Article 7, and I specifically looking at removing the Real Estate Committee per our discussions, that the items that would come before that are going to have to come before Budget and Finance, if they are financial, and/or directly to the board, and strategic planning already, given the scope of strategic planning in those items. Also, clarify that new officers begin their terms on January 1. It came to my attention rather recently that that's not clear in our bylaws. And any updates that we need regarding the bylaws on the Health and Safety Code, any cleanup and consistency issues in the bylaws, any immediate work that's necessary on our HR policies, including review and update of the anti-harassment and retaliation policy and the corrective discipline policy as recommended by staff and attorneys. And in the longer term, I would ask the committee to work with staff and attorneys to review and update the HR policy handbook as necessary. So I know that that is a long list, but we've needed this, I think, ad hoc committee. And some of these items obviously would be of a need some extremely immediate attention, and others future work. So that's we don't have to take action on that. We have another standing committee, which is the Ad Hoc Women's Health Committee. This was created by a prior chair who established this committee. That committee was originally created to ensure that the Central Health Board of Managers set direction and strategic vision for sexual and reproductive health services funded by and directly contracted by Central Health, specifically for women. And this had to do with, our contracting with Planned Parenthood, with issues regarding the scope of Seton and Ascension and some of those matters. The committee has done tremendous work on these sexual and reproductive health matters, but I would ask that the scope be expanded to be looking at general items of women's health, including sexual and reproductive health, and also looking at other general items such as cancer screening and other matters, and that this include, when it is related, sexual and reproductive and cancer and other related issues for people who are of other genders, be they male, LGBTQ, transgender, intersex, as it relates to the work. Again, no action needed, but something that has come to my attention that according to the bylaws as chair that I needed to establish scope for that committee in the prior one. Yes, Manager Jones.
Per our discussion in our previous meeting, I
Right.
would like to elevate that. And I am very supportive of the Ad-Hoc Committee on Women's Health. I think it's something needed, it's been supported. Actually, I was a member of it for a brief period of time. I do have some concerns about expanding its scope to include other areas, particularly as it relates to male health issues, because I think, in my view, I think to a degree it diminishes its ability to focus in on particular areas that it was originally signed to do. Now, those I think should be expanded. I would encourage the board to consider, particularly looking at the data, addressing the issues of minority male health issues, either as a separate committee or some way making sure that area of this work is highlighted, focused in on, and a subcommittee separate address to that. Because whereas I'm a strong believer that there is a need for a women's health committee, I also believe, given the data that we see, particularly men of color have a disproportionate burden of death and disease in this community, life expectancy will speak to that as well. I think that we need to consider that as maybe as a subcommittee or at least a standing ad hoc committee in and of itself.
Members, any other comments? I would like to ask, in fact, the Strategic Planning Committee, Manager Bell is chair of the Strategic Planning Committee at one, and I know that Manager Jones, you serve on that particular committee and in fact are chairing a different subcommittee that we'll talk about in a minute, to look at in the Strategic Planning Committee addressing these concerns, which are paramount for men of color in our community, and see how strategic planning might address that. Would that fit?
I think that would be
You
perfect.
think within the scope of strategic planning? Okay.
Just to make sure I'm clear, so that would be I have no problem with the subcommittee, but in terms of statute and standing with this ad hoc committee on women's health, the question is, would that be the same?
So I don't know. What I'm asking is for strategic planning to work through our committee structure, and for the strategic planning committee to take up the issue you've raised of particular issues and attention to issues of mobility and of health of men of color. So I'm asking to work within the strategic planning committee. You're going to discuss that in the strategic planning
And our hope
committee.
is that we might come back with recommendations to the greater board.
Yes,
Okay.
exactly.
All right, then.
Exactly that. And on the ad hoc women's health, I don't foresee expanding it to all men's health or LGBTQ. What I was saying is, if there is an issue that also intersects where it is sexual reproductive health, that we not ignore that, or a cancer that primarily occurs in one population but can occur in others, that we not ignore that, was my intention. Members, is there any other questions or comments on this? We don't need a motion on this particular item. The last one on this item is Strategic Planning Committee has had a meeting, and one of the things that was discussed at that was the subcommittee that has been formed already within strategic planning, the Strategic Planning Committee's Eastern Crescent Subcommittee that I know Manager Jones chairs that subcommittee, and Manager Valadez serves on it and is working with him. And after that meeting, Manager Bell had some wording for a draft scope for that subcommittee that reads as follows, and I know everyone has received it, and I would just ask if you have any comments, get them to him within the next week. To Stephanie, thank you, not to Manager Bell, but to Stephanie, thank you, I stand corrected, within next week, but it reads, Manager Bell's current language reads, receive and discuss reports and updates from staff regarding demographics, service level, data updates, and tracking service delivery enhancements in order to address disparities, to build equity and access, and to improve healthcare in the Eastern Crescent. So I just want to bring this to everyone's attention. You've received this, but if you have any comments on that, to get it to Stephanie within the next week, and that's where we are.
If I might just add to, for the benefit of the
Yes,
public,
Manager Jones,
we're
please.
also looking at a strategy to identify what the Eastern Crescent is,
Absolutely.
and to look at
Right.
breaking it into pieces so that we can manage it
Right.
in terms of strategy, because
Absolutely.
it's the whole eastern
Right.
section
So,
of the county,
yes.
and so we talk about
So
strategy.
yes, absolutely. That's the work of your subcommittee. This is just giving a definition to the domain of this subcommittee.
Right.
Okay, anything else, members? All right, well, we have no motion that is necessary on that, so we will move to, that was item number 3, am I correct? So we're moving to item number 4. Discuss and take appropriate action on an update regarding Sendero Health Plans, Inc., including the effect of federal legislation and regulatory actions. We have, and my understanding is no motion is necessary on this. We have Stephanie McDonald and Wes Drakowski will be presenting. And we will start with this. If there are items that need to move to closed session, then we will take that as it comes. And I would also ask Manager Bell, our vice chair, who is also our representative on the Sendero board, to please lead this discussion.
Sure. Thank you, Stephanie. And what we're going to do today is to give you an update on the CHAP expansion and outline where we are today. As the board knows, we've been quite successful in not only adding members, but you'll also see a presentation of our final 2019 budget, or financials, I should say, by Wes. And so I think I'll let Stephanie go first.
Well, I have the privilege this evening to report that we have achieved one of the strategic goals and objectives in the fiscal year 2020 budget resolution. It was continue to identify and offer high-risk Travis County residents enrolled in MAP or MAP Basic the option of establishing health coverage through Sendero Health Plans. And we had a target of 500 members, including the existing top population from 2019, as well as new members that were identified by our data and analytics team. And we enrolled through our eligibility and enrollment team 536 people, and this was an enterprise effort from both the Sendero folks as well as the Central Health folks. And when I say folks, this is actually just a handful of people. And so I'd like to really make sure that they are recognized. I hope they are eating their dinner and spending time this evening with their families, but maybe they're tuning in. We've got Stephen Yee and Sarita Clark-Leach on our data and analytics team who did the bulk of making sure, reviewing the data. And I'll be honest, it's very difficult. It's an incomplete data picture, and I think you know some of our data challenges. And then Kit Abney-Spels and Becky Huerta on our eligibility and enrollment team. It's the two of them. They don't farm this out to others. They don't delegate it down. Becky is, as you know, very committed to this population. And she and Kit very diligently scrub through and make sure that they are reaching out. They do use United Way and the United Way call center for that. And we will have to think about what that looks like in the future. On the Sendero side, and I think it should not be left unnoticed, that we work and had weekly phone calls with Tiara Thomas, and who's the Director of Operations at Sendero. We've got Rudy and his outreach team. He's the Business Development Director. And there's Gracie. There's one person at Sendero who had to answer and field all of these enrollment calls. And I think at one time she had at least 6 lines that were all on hold. And he was on a conference call. And you, Wes, may know others on the Sendero team, but it is a relatively small team that was trying to outreach to the members, the community health workers at Sendero, who made sure that everyone was eligible, and that included they were still Travis County residents and that they were still meeting the income requirements of being under 200% of the federal poverty limit. So we ended up with 156 returning members from 200 that were in the CHAP expansion program last year, and then 380 new members. I would like to point out, because this is something that was really eye-opening for me, there are children that are enrolled in this program, and I think it's interesting that without this, I think they would not have access to really life-saving care. And so I think that was, it's always interesting to see what a network can provide, an insurance product can provide for these people that are very sick. So I think that I get to report out on this, even though this was technically John Morgan's reporting objective. But I think that I would be remiss in not acknowledging Jeff Knodel, who is the brains behind all of this. Sometimes I think he is the wizard behind the curtain, but Jeff really is he's the true director of marshaling the forces. There's a next step, and I think Wes can talk more about some of what they're doing, but we need to get all 536 members. They need to have a health risk assessment. They've been reached out by a community health worker from the Sendero team. We need them to utilize the care appropriately. There's been a lot of conversations that have been going around the enterprise about case management and care management and making sure that we have an enterprise effort. A lot of that stems from a work group that Monica Crowley's enterprise planning effort has generated. We have people from Community Care, Sendero, as well as Central Health, all working together. I got to meet with a group of them. We walked the RN at Sendero, walked them through the network and how to making sure they got the right glucometer and other knowing what benefits were included. But there are so many committed social workers, RNs, and community health workers across the enterprise that are doing their part to shepherd this population, making sure they are getting the care that they need, and then also utilizing the appropriate level of care. So maybe more to come in that space, but it's been, like I said, an enterprise effort. This is the beginning. We will be, of course, monitoring both the population as well as the fiscal impact for Sendero. And I think in closing on my end here, I think it's really, we had to start with 536 because we know we will not end with 536. This is a very sick population. This is a population that one case manager said, you can't tell who's going to pass because there are some people that have what seem like very mild issues that will pass, and I think I heard this from a Sendero community health worker. And then, others that are chronically ill and have been having debilitating illnesses that Sendero, their coverage keeps going. So, Wes, I'll turn it over to you because you have the hard part. You have to make the money work.
Thank you for that, and I would second all the thanks to everybody on the enterprise side that helped out to make this possible, and of course the entire Sendero team appreciates it and is happy. I think the quick key stat I could say is that at this point already 80% of the new people, so I think that's 310 or something like that, have already been evaluated and triaged, so we're already working their way into the system. So there's plenty of care that has to happen for the rest of the year, but at least for a good starting point, we're in a good position, better than last year. So we're happy about that. And on the CHAP program, yeah, we're currently making plans now to see how we can help more of the people that Stephanie mentioned, because there is a great need for this program. Before I step into, we have one financial slide we wanted to present tonight. Before I do that, I do want to share a bit of news, bittersweet news. One of my key employees, specifically our Chief Medical Officer, has received a battlefield promotion. Not from me, so I think the easiest way to say it is just to read a quick statement. And this is from Dr. Allison. He'd like to thank the board for the opportunity to serve Sendero and the community with its important mission. The CDC has asked me to lead hepatitis elimination efforts in 37 countries in East Asia. And not surprisingly, you will be assisting with coronavirus prevention. Despite the important work Sendero is doing to serve the poor and vulnerable in the Austin area, I felt it was my duty to accept CDC's request. Of course, we accepted that. I have great confidence in Sendero and its continued success. I will miss Austin community, collaborating with Central Health and Community Care, and all of the people at Sendero. So, on his behalf, thank you. And we have already been working on lining up a successor CMO and have some good leads. So hopefully we'll be able to make an announcement about that soon. We're pretty proud. I mean, we'll take all the credit because he's not here. So we're proud that, yeah, he's going on to bigger and better.
Good for him.
Yeah, definitely. It's pretty well. On the financials, I know we're going to broadcast it. It's already in your packets, I think.
Right.
So if everybody has one. The financials, I'll just sum up the key thing. The financials played out, you know, as well, maybe a little bit better than expected. So if you remember, we came back in November, and we were here last year, I think, in December. We were projecting results in line with our 2019 budget. We had projected just over $1 million net income. Our draft at this time, you know, plus or minus a few million, our draft net income is slated to be around $4 million. That's the nature of insurance. I know, I wish I could make it more definite than that. But the best estimate is a net income of $4 million for our 2020 budget. Because we are increasing the number of chat members, we wanted to be conservative. And so we'll leave that with the approved budget of about $500,000. So in short, to kind of circle back around, you know, we're happy to see that the chat program has been a success all around. We were able to provide full care to a lot of people that needed it without hurting our financials. So thank you I cannot thank you enough on behalf of all the people for letting us do this.
Wonderful, thank you, great news, and thank you for everyone's hard work, past, present, and future, and those who are here and who are not here. We thank all of you.
I just would like to congratulate you on your success, Wes, and your board members.
That's right. I happen to have our board chair here tonight,
Okay,
Dr.
so
Bell.
your board, you know, your board members, your team, you know, your entire staff, and I want to thank our board and our staff at Central Health for having been supportive of you in this effort and supportive of however it went down this past year with respect to salvaging this. But I want to tell you, I'm very happy and very proud.
Thank you. Okay.
Thank God.
So, yes,
Yeah,
Manager
I'd
Jones,
like to
yes.
piggyback off of Manager Valdez, because I can remember sitting in the same room about a year and a half to 2 years ago when we were talking about shutting down. And here we are finding ourselves. And so it's a commitment to you, your staff, and the work you've done to make that decision worthwhile. And to the taxpayers and the community as a whole, I think we owe you a gratitude and your staff for the work of getting us to where we are. It really has addressed the issues of many of our community that are not always seen and not always appreciated. And as staff was, Ms. McDonald was saying, you know, they are not always viewed and highlighted. So I want to thank you for the work that you have done very much so.
Thank you. Appreciate it. Very much appreciate it.
Yes.
Thank you, Madam Chair and Dr. Vice Chair. I'm proud of you too, Wes.
Yeah.
I really am so proud of you and your team and Jeff and Stephanie, everybody that's done the work that you have done. It's incredible. Thank you.
Yes, Manager Bell.
Well, since everyone's thanking, I want to make sure that you know that there are two board members in the room, Mr. Wallace and Mr. Canova. They have done extraordinary work in helping me to guide our organization into the light that Wes has taken us. So,
Thank you.
thank you
The
very
light.
much.
That's right.
All right. Anyone else? Okay. All right.
I'll say thank you as well. I just remember what an emotionally fraught decision that was a year and a half ago, and I really feel like this board made the right choice. I'm so grateful. We saved Sendero.
Thank you.
Thank y'all. Thank y'all.
We,
Just one last thing, we can't forget thanking the county commissioners, that's all. I want to thank the Travis County Commissioners.
all who are here and not here, yes, absolutely. Thank you very much.
Thank you.
Appreciate it. All right. Next item. discuss and take appropriate action to renew and amend the employment contract between Central Health and the President and Chief Executive Officer of Sendero Health Plans, Inc.
I recognize.
You are, absolutely. Take it away, please.
As you know, when we developed Wes's contract last year, I brought it before the board. The board reviewed it and approved it. And so we went through the year. We developed with Susan Willer's help a evaluation tool for Wes as a board. And we collected information on that evaluation tool, and we provided that evaluation and additional comments to Wes as the president and CEO of Sendero. And in tabulating everything, he exceeded expectations, especially with the fact that, as you guys said before, he brought our organization into what didn't seem to be such a great state 2 years ago, but now our bottom line is somewhat stable, and we look as if we're a sustainable organization into the future. So, based on that contract, it has to come before Central Health for not only approval, but we do have some amendments to the contract. And I don't know if you want me to go through those, or if you would like to go through those, Susan or Polly. Either one.
You can go.
I can go through. Okay.
Proceed, please. Proceed, Manager Bell. Thank you,
Okay.
Vice Chair Bell.
Manager Jones, you seem to.
Yes, I'm a little confused in terms of, so we're taking action on the recommendation this evening?
We're taking action on his employment agreement for the next year,
Based upon the evaluation that was done last year.
based upon the fact that it has to be amended, the contract does. And it's amended for a couple of things. Number one, it's gonna extend the agreement for an additional year because the agreement only was for 1 year. So we have to approve that we're gonna go into another year. And it's actually sort of outlined on your resolution that's in your packet, which I will read.
Well, if you would, because I did not get my information here in the agenda until I got here, so.
Okay. Well, I will read the resolution
Okay.
before you pass it. So it's in your packet on page 10.
It's in here.
Okay, it's on this document.
Yeah.
I didn't receive it, that's what I was saying.
Page 152.
151, 152,
Oh, I'm sorry,
153.
152, yeah.
Yeah.
I'm looking at.
You're looking at different, there's two paginations on there for some reason.
Towards the end.
You got it?
Yes,
Okay.
no, I don't have it, 152?
Starts on 151,
151 and it goes to
152, 153, those pages.
Is this the same?
That's it.
Yes, that's it. So between Central Health and Westakowski, because he's the CEO for Sendero.
Okay, I'll just,
Us.
okay, go ahead, sir.
Got it?
Yeah.
Okay. So, like I said, I'm gonna summarize first, and then I will read it word for word prior to us taking a vote on it. As I said, we will be extending his contract for the next year, up until January 1st, 2020.
This year.
To begin on 2020, and it will end on January
December
or
30th.
December 31st,
Right.
2020.
They're on a calendar year,
On a
yeah.
calendar. We also will be amending his contract to outline a 2% increase in his base salary because he did receive a performance review that exceeds expectations. We are also looking at an amendment to modify section 5.3 in the contract. And all it does, from what I can tell, and you can correct me if I'm wrong, is that it takes out the fact that we have to come to the board every year to extend the contract. So the board doesn't have to approve that extension of the contract. Holly?
Well, I will say that the initial agreement that we're amending today was a 2-year contract total. So next year, we're looking at a new contract unless we amend to extend. What section 5.3 was amended to do is make clear when a merit increase could be awarded to Mr. Durkowski. There were 3 different people who are very smart on the Sendero board who had different interpretations of section 5.3 about when a merit increase could be given. Some thought it was anytime Mr. Durkowski met expectations. Some thought it was anytime he exceeded expectations. And some thought that the 25% number here in that section related to exceeds but not to meet. So I tried to clarify what was intended.
I didn't know we had caused so much trouble, but yeah, okay,
Hopefully this will help.
all right. I would have never been able to explain that. I appreciate it.
That's why I said go ahead.
Okay, so with that, those are the major changes. I will read the renewal resolution. This first amendment to the employment agreement between Travis County Healthcare District and Wes Durkowski is made between the Travis County Healthcare District doing business as Central Health or District, a political subdivision of the state of Texas, and Wes Durkowski, thereafter to be as hereinafter referred to as the executive, effective as of the date of the last signature affixed hereto. Witnessed, whereas Central Health, as the role of sole member of the corporation doing business as Sendero Health Plans Incorporated, Sendero, has authority to enter into an employment contract with executive and enter into an employment agreement referenced above on April 12, 2019, the agreement. And whereas Section 2.2 of the agreement permits the Sendero Board, with Central Health Board approval, to extend the agreement for up to one additional 1-year term to begin January 1, 2020. And whereas Central Health and Sendero desire to continue their employment relationship with executive, and whereas Section 5.3 of the agreement permits the Sendero Board, with Central Health's approval, to grant the executive a merit raise in his base salary if he achieves a performance review of exceeds expectations, and whereas executive earned a performance review rating of exceeds expectations, and whereas Central Health and Sendero desire to provide executive with a 2% increase in his base salary on account of his exceptional performance, and whereas Section 11.2 of the agreement permits Central Health to amend this agreement in a signed writing, and whereas Central Health desires to amend this agreement to clarify when a merit increase may be awarded to the executive pursuant to Section 5.3. Now therefore, Central Health and the executive agree as follows. Amendment. Number 1, the parties agree to amend Section 4.2 by modifying the first sentence of that section as follows. 4.2, base salary. The base salary of the executive for 2019 shall be $325,000. Number 2, the parties further agree to amend 4.2 by adding the following sentence immediately after the first sentence. The base salary of the executive for 2020 shall be $331,500. Number 3, the parties agree to amend section 5.3 by deleting it in its entirety and replacing it to read as follows. 5.3, if executive achieves an overall performance review rating of exceeds expectation, then the board may, with Central Health's approval, consider and grant the executive a prospective merit raise in his base salary. The amount of such an increase may not exceed 25% of the executive's current base salary. Renewal. Number 4, Central Health hereby renews the agreement for one additional year term beginning January 1, 2020 and ending December 31st, 2020. Number 5, except as amended above, the agreement shall remain in full force and effect, being hereby ratified, approved, and affirmed. In witness thereof, the parties have duly executed the First Amendment and renewal. To be signed by Mike Giesland and Wes Dukowski. So, Madam Chair, I move that the board approve the amendment and renewal of the employment contract of the Sendero Health Plan's president and CEO.
Second.
There's a motion by Manager Bell, there's a second by Manager Zamora. Yes,
I have a question.
Manager Valadez.
Okay, and I'm gonna put this as succinctly as I can. Based on the performance of Sendero and the CEO, or the executive, and knowing that they operate on a calendar year and we operate on a fiscal year that is different from the calendar year, I'm struggling to understand why we are approving a contract for 1 year at a time based on his exceptional performance. Should it not be on this particular renewal or resolution? I would think that it should at least be for 2 years, because you have to be able to plan. You have to be able to plan, and you can't plan based on the fact that you're only operating on a 1-year budget, not knowing if your contract is going to be renewed. He has proven that he exceeds expectation, and I suggest that it be a 2-year as opposed to 1 year. That's just, and asking if you would accept that, that's all.
Well, I would sort of turn to my legal counsel and say, I'm sure there's a reason.
I will let you know that that is possible. We can further amend this agreement to include a longer term. Right now, the contract is only for 2-year term, which is why it's 1 year plus 1 year renewal. The Sendero Bylaws reserve to its sole member, Central Health, the power to enter into employment contracts. So it is within your authority to change the employment contract term, but this is not legal advice. You do have a Sendero board, and you may want their input before you do that.
If I may.
Just to respond.
Yes.
Very quickly, since the Sendero board, and I'd like to know whether or not there was a unanimous exceeds expectation evaluation to Mr. Dukowski. Whether it was a unanimous board decision.
It was collated. I mean, just
Okay.
like we did
Okay.
for mine.
Okay, so with respect to that, I again would ask whether or not we could make that a 2-year at least.
Manager Zamora?
Thank you, Madam Chair and Dr. Bell. I agree with Manager Valdez. You know, it's so hard to find great CEOs, just like I have one here to my right. And to not award him with at least a 2-year contract, you risk the chance that somebody could steal it from him. So I also strongly suggest that your board consider that too, Dr. Bell. This guy's a good one.
So, if I may, I feel like that's something that the Sendero board should be addressing.
Suggestion.
And that they had ample time and meetings to address all this before bringing it forward to us. I am ecstatic about what we saw as far as the membership. However, I also saw that that although it's not expected to affect the financials, the membership was lower than expected. Is that correct? When I was looking at the financial,
Talking about the ACA membership?
yeah, when I was looking at the, so.
That's 12,000.
So I would not want to take that type of action at this board. I would want to leave it to, I would want to go ahead and move forward with this. And as I said, Sendero has a board. They obviously discussed this and moved forward with what they felt was appropriate, and that's what I'm comfortable with.
Just a suggestion.
Yes, Manager Jones.
Just respond to that, Brian, because I have a different question. So.
Just to give this conversation closure, at least with respect to right now, I'm still asking whether or not you will allow increase it to 2, and maybe with the understanding or the preface that we are approving this up to 2 if it is the determination of your board that is appropriate, so that you don't have to come back to us again and ask us for that. I mean, it's like a pre-approval, so that you don't have to bring it back. And the only reason I say that is because I don't believe that you all may, and I don't know because I'm not on your board, but I don't know whether or not you even considered any additional amount of years. And if you didn't, then I'd like to ask this board to consider approving that with the consent of their Sendero board, who can meet at a future date, but they'll know that they don't have to come back to us.
Yes.
Let me just say for the record that the Sendero board didn't know his contract was actually needed to be renewed. Okay? So this is our first time going through the contract. If you sort of realize when I presented it to you last time, this was the first contract that we had with him. This is his
Right.
first performance evaluation that the board has given. We're in a learning curve
Right.
at this point in time.
I agree.
So when this came up, I have to admit I was a little surprised because I didn't really know that it had to be renewed. I thought Mike could approve the merit raise, and he did. And then that would be the end of it. And then I saw this on the agenda. I thought I interpreted what the changes were. As you can tell, I did miserably. And so, in essence, it came before the board. I thought I heard Holly say that this was a two-year contract.
And we're in the second year.
And we're in the second year of the two-year contract. Maybe you could help me here and tell me, if it's a two-year contract, why did we have to come back and sort of approve it?
Absolutely. So in the initial agreement that was executed last year, the Central Health Board reserved to itself 2 things: the ability to approve of any renewals, and this was because of the financial state that Sendero was in
At the
last
time.
year, and also the ability to approve any increases in the salary or the base compensation. Going forward, if we want to enter into a new agreement, we can reevaluate those things. We don't always have to include the right or the, I guess, reserved power to come back at every step of the process.
So with that in mind, I again am going to ask whether you would accept the amendment. And the reason I'm saying that is because this was the first year. We're going through the learning curve, but we are seeing that the risk that we took has in fact paid off,
So,
and I would like for us to, do I need to make
I'm
a
gonna ask a
substitute
question before
motion?
you do that. I need to ask a question before you do that because it's a legal question. What I heard was this is a 2-year contract.
That's right.
There's going to have to be a new contract. I don't know how we could direct the Sendero board to add an extra year to something that only has 2 years. I think they're going to have to do a new contract because it was only a 2-year contract.
Right.
But Manager Bell?
Well, that's what I was gonna say.
I don't-
It's a two-year contract.
That's it.
Ms. Valadez, we don't have,
That ends when?
Next
December?
year.
Yes,
I mean, this year.
This year, it ends
December
this
31st.
year.
That's right.
right,
And so then we can take into
months.
consideration
right.
the issues that Holly brings to the table with
Right.
regard to the reserved powers
Right.
of the member, which is Central Health.
Right.
And so if you want to take those items out of his contract and you don't reserve the power to renew based on an extension and the other powers that she mentioned before, then you can take those out. And then we don't have to come back.
But in a new contract,
In a new
not
contract.
in this
Not
one.
in this one.
Not in this one. You're gonna have to wait until there's a new contract.
Excuse me for
Yes.
clarification from our legal department, please. Holly, I asked whether or not we could amend the motion and make that for 2. And I said specifically for planning purposes, this was gonna end at the end of this year, okay? We're going into March, okay? So, since they operate on a different year than we do, I would hope that having faith in the work that he did, and has proven to us that he can do, that based on the fact that his board exceeds expectation, I'm not telling them that they have to do it. I'm saying that if their board approves this up to 2, they don't have to, okay? Then let it go through. And that's the only thing I'm saying. This is the first time we're doing it, but I don't see why we're hogtied to a 1-year renewal that ends at the end of this calendar year, and he's still in the middle of planning for next year.
Okay, so,
Yeah, so,
Julie?
so let me see if I can
Yes.
explain. There is the possibility of, just like we're amending section 5.3 in this contract, amending the section that speaks to the term of the contract. So right now it's a 2-year term.
Right.
We can make it 4-year term or a 5-year term.
Yeah.
That is possible. But I think what I'm hearing, because we all have to speak with consensus on these things, or at least with the majority of us,
Majority vote.
that you would have to put that as a motion and have it voted on in order for us to do that.
Well, I was
so may I
prepared to
ask
make
a question?
substitute.
Yes.
If you let me accept the amendment.
So my understanding is this contract ends, right? And to me, it is up to the Sendero board, not us, to determine, since this contract is ending, if they want a new contract, how lengthy they want that contract to be. They could come back to us with recommendations on that if we want to do away with reserve powers. But that needs to go to me before the Sendero board to look at a new contract and what they would like to see in it. So, Manager Oliver?
Well, I was gonna say,
And then
I don't think it has to be a new
support.
contract. I think Holly's saying we could say it's a 3-year contract now, because we'd amend the term to 3 years, and then this renewal term would be a 2-year. That would go
But-
through the end of 2021, so that's not a new one, it'd be an amendment. And 2, I also think that Manager Valadez said that we would agree to this resolution pending approval
by the board.
Sendero
Manager
So-
Zamora?
Oh, I think you're right, Manager Greenberg, Chair Greenberg, that we have to let Dr. Bell and his board manage this. It was just a suggestion from my part.
I understand what you're saying, but I also understand that we would be making a change. This was a 2-year
An
contract.
amendment.
Yes, but an amendment is a change. This was a 2-year contract, and I feel strongly that it is up to the Sendero board to look at what they want to do with this contract going forward, how many years they would want it to be, what provisions they'd want into it, and I feel strongly that it's not something that we should be doing without their guidance and without it going back before their board, which is where this originated.
I agree, that's why I made that particular provision.
I'm saying, I think that they need to go back, discuss this among their board, and then they can come to us with recommendations for the future.
Do we not make this motion tonight, or do we proceed with the motion, and what if y'all?
Well, my feeling is that, I think that as we learn about this contract, that our Sendero board needs to consider it.
That's
And
what I'm
then
saying.
we would make the recommendation
Yes.
when we come back next year with regard to the term that we would like. And then it would be this board's decision as to whether you give it to us.
Right, and that's what I was saying. Manager
And, Madam Chair,
Zamora,
I would
and
call
then
the question.
You're calling the question? Okay, the question has
So
been
you
called.
need a second on that one.
Second and a 2/3 vote.
Is there a second on calling the question?
No, I was not, I deferred to her.
Oh,
during
I'm
the
sorry.
question. I didn't get the chance because it was related to that.
didn't get to speak.
My mistake for
No
not
problem.
keeping track. Could you
I'll
retract
I'll
that?
check
I'll
And Manager Jones,
I'll
thank
make
you.
it brief, yeah. I just, I'm sitting here and I'm really concerned about, not so much our discussion, the salaries we're talking about. When I look at, and I just randomly, I'd ask HR if they could help us. When we look at our partnership in terms of Sendero, Community Care, Central Health, I'm not sure if I've left off one here. The
CCI.
tops, pardon?
CCI.
The
They're
top,
No, they're not part of our enterprise.
the top the CEOs of those, is it possible, would you happen to know what the total salaries of those three agencies are, partners are? Because this, this population, and I have nothing against Wes, I think he's done an excellent job, and I think I spoke to that. But this is disturbing.
So let me say, I think you were asking, one of the questions you were asking about was the base salary of our CEO, is that correct?
For all three of the.
Well, I don't know all three,
And I don't know if it's appropriate in this discussion to have
and
that, but.
I don't know either. Holly, are we within the bounds of this item?
Well, I think you're asking about the compensation term of the amendment,
Right.
and I think you're wanting to know, is it comparable to other CEOs? Not exactly what you asked, but if you were asking that question, that would be within the scope.
I'm asking that question.
So, Manager Jones has asked that question, and I think part of the question that he asked was, is it comparable within the scope of our enterprise? And part of that, for instance, would be our CEO plus a couple of other CEOs. Is that what you were
Right.
asking?
Yes, because if it is comparable, we're talking close to $1 million for executive salaries, which I don't question their skill sets. But I do have a problem with, our target population, $1 million worth of just executives. And Mike, this is not reflected on you or any other CEO who may be here. But from an ethical point of view and an equity point of view of the population we serve, we need to at least ask our HR to look at this issue and where do we sit in concert with other districts around the state.
So I don't know if we're within the bounds.
Well, I put that out just
Right.
for
I-
conversation, but
I-
you get my point.
Oh,
I'm real
we
I
concerned about
completely
this.
and totally get your point, Manager Jones. I assure you, I completely do. And so let me say, I know that we have a posted item, and we have to stay within the bounds of that. But I believe that we have other ongoing work from HR to look at compensation schedules and comparability. That's probably all that I can say, given what is posted. But I completely understand your concerns. Manager
I
Valdez.
agree in the totality of the enterprise. However, this is a different business. This is an insurance business as opposed to direct provision of healthcare services. And so in that context, I would assume that we would be making comparisons with insurance companies that provide similar
So
services,
we
if
have
you want
to-
to be correct
We have to
and
stay
legal on
within
it.
the bounds of the item,
So
but,
that you understand
but I
where
will
I'm
say
coming.
that I am sure that with the ongoing work of that research that is being done, that yes, apples would be compared to apples.
Thank you.
But within the bounds
Yes,
of the
Manager Jones,
conversation,
yes.
these are dollars, dollars are contributed to this effort from this institution, or from this agency. So we contribute to that. And so it's in that vein that my question is raised.
Within the vein of how you raised your question, I share your concerns.
Then I'd still like to ask whether or not I should make a substitute motion or an amendment, ask if he would accept my amendment, because that's what I started off my conversation about.
I will not accept your.
Okay, then can I make a substitute motion? Or just, well, I'd be,
If you're recognized, you can make a
Okay.
substitute motion. It has to be seconded and it has to be,
a vote. I get it. I get it.
A substitute motion to
To my motion.
to Manager Bell's motion?
I'm still concerned about this contract ending December of this year.
I mean, I'm not prepared to recognize at this point a substitute motion, given the conversation we've had and Manager Bell's response to your amendment.
Then point of clarification. Would it be possible if your board had this discussion prior to, sometime within our fiscal year, would you be able to bring back a possibility of an amending this particular contract? That's, if you understand what I'm asking.
Yes, I think this matter will be taken up by the Sendero board is what I'm hearing. Is that correct, Manager Bell?
Yes.
And they have direct oversight for this matter, whereas we do not.
Taking into consideration
Yes.
the time lapse. and-
Okay. Anything else on this item? So we have a motion. Do we have a?
You have a second.
And we have a second, right? We had a motion by Manager Bell. We had a second by Manager Zamora. Is that correct? Is there any other discussion? Questions, comments, or discussion on this item? Okay. Then, all in favor, say aye.
Aye.
Opposed, same sign. Any abstentions? One abstention. Manager Jones. All right. The next item
Thank you.
before us is item number 6, discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition or lease. We have staff coming forward, as well as we have Perla Cavazos and Nicole Mead of Hush Blackwell will be presenting on this item.
Good evening, managers. We wanted to provide an update on a couple of real estate issues, and Stephen Lamp is joining us by telephone.
Okay. Hello, Stephen. Thank you for joining us.
So we have to have visual as well.
Okay. Yes, we do. You're right. Okay. Hello, Stephen. Thank you for joining us.
Can you hear us, Stephen?
Apparently not.
Stephen, can you hear us?
Hear us?
Very weakly, but I can. Turn up the volume. Can you hear me all right?
Can you hear us, Stephen?
Sounds like he.
Can you turn up your volume?
I can hear you now. Can you hear me?
Yes.
Yes, we
much
can
better.
hear you. Thank you for joining us, Stephen. We appreciate it. All right.
So
Proceed.
let me just open it up. You know Nicole Mead, our consultant on local government and legal issues. And we wanted to start by giving you an update on the zoning case and other related matters that are before the Austin City Council. So and some of you have joined us on some of those city council meetings that we've been doing, but yes. I'm gonna go ahead and just hand it over to Nicole so she can give you an update. And some of this might be done in closed session.
Multiple other discussions.
Council, will you let me know if we need to go into closed session, please?
I can hear you now. Can you hear me?
Thank you.
Good evening. Thank you for letting me be here again. Nicole Mead with Hush Blackwell. I'll give a really. Oh, is Steven saying something? Sorry, I thought I heard him say something. Just a really quick overview or update on some of the other things besides the zoning overlay that have happened in the past couple of weeks. You all got your demolition permit for the buildings on the Breckenridge Hospital property. That was approved and released about a week ago. So you have the all clear to demolish the buildings that you need to demolish. We also, I think, got to a almost final spot with the design of a new Red River Street through the Breckenridge campus property. And then we have made some progress and are pretty far along on an interlocal agreement with the city of Austin that addresses the realignment of Red River Street. So I wanted to give you all those 3 updates because those are things that were completely in limbo the last time I had the opportunity to present before you. The zoning overlay, you all may remember we have the P basic zoning. We're asking for an overlay to establish the site development regulations. Sort of looks like central business district zoning, but we're asking for 25-to-1 Florida area ratio, and we're asking for a little bit different mix of uses. That was scheduled, I think, the last time we were here to be on the January 23rd council agenda. It got pushed to February 6th, and then I think pushed to February 20th. I may have more postponements in there than actually happened, but it is now set for March 12th. What has been happening there is that the city attorneys are still working on drafting the ordinance that needs to actually be the document that city council approves. And that takes them some time. We've given them a lot of stuff to put into that ordinance, but the city attorneys actually have to draft it and get it in final form for the staff. They have promised us that we'll have a draft of that by March 4th. So as soon as I get that, of course, I'll be distributing that to you guys to start reviewing. We've been in pretty constant communication with the city council members and the city staff, the city housing department about the overlay, really to try to understand any concerns that may come up. We always want to proceed with the city as partner, and so we want to get concerns addressed ahead of time. We don't want to wait till the last minute and realize there are concerns. We've talked to many of the council members. There have been some that we haven't had an opportunity to have one-on-ones with, but so far I would say the overall feeling about the overlay is pretty positive. We've definitely had some questions and concerns that we've been able to address, but could come up in our public hearing. But overall, I feel like everybody's very supportive of what we're trying to accomplish there, which is really to enhance the value of the site to be able to provide for the mission. And so, March 12th, we think that day is going to stick, but you never know. It's city council, so it could get postponed again. And I'm happy to answer any questions. So far, like the meat of the overlay, which you all mostly have seen, may just be those who've participated in the meetings, but I think all of you have seen some version of it. But the meat of it really has remained intact. We haven't had many people, council members or staff, want to take things out or add things to it. It's kind of stayed really intact. And so what we requested so far is what's still proceeding along. And thank you to those of you who've been in meetings. It's been unbelievably wonderful and helpful to have you all there. I know Manager Jones, I know Manager Greenberg has been in meetings, Oliver, and of course Mike has been in meetings, and Perla in all the meetings. So just really appreciative, and I think all of you have at least offered to let us call upon you and keep those offers open because we have more meetings to do.
There's still a few more meetings left. Thank you so much.
Absolutely.
For your hard work. Thank you to all of the staff also who I know have continued to work so hard on this. Members, Manager Valdez?
Just a question with respect to whether or not there's going to be any action on this or not. Because on the agenda it does say as an action item. No action.
No, no motion is necessary on this, is my understanding.
No, I was just referring to.
Right. My understanding is that we do not need any kind of motion on this item. Is that correct, Council?
Informational.
Right.
Yeah.
No motion necessary.
My assumption would be that there is always a chance when we can present this that some request has been made by the city staff or the city council and that the board of managers would need to act on. It's just that in this case that didn't happen. Nobody's really requested anything that is new.
Right. Thank you. Yes, Manager Jones.
Would it be helpful to be at the, not that I want to go to City Hall again.
And it's so painful because it ends up being
not
all
your
day.
first rodeo, huh?
No, I'm just saying, but would it be helpful for us to attend the, of course, I know it could be, we don't know exactly when it'll be, so.
I think it's extremely helpful. In particular, those of you who've been in meetings, those of you who have connections, which is all of you with the council members, I think it's very helpful. And you're exactly right, Manager Jones, that it's a marathon. because the meeting starts at 10, but all of y'all know it doesn't really start at 10, and it goes all day, and we don't really know when we'll be heard.
Right.
So maybe even if you all could organize, maybe, 2 or
Some
3 of you
shifts.
be the shifts. Yeah, exactly.
Or
That would
some
be
kind
good.
of way to alert us, an alert system. Yes.
That's right.
Manager Valdez?
Yes, I just wanted to ask whether or not there's any possibility, or that we could at least push for this to be considered or included in the agenda, on the consent agenda?
So
as
as
opposed
of
to having a
now,
public hearing?
as of now, amazingly, it's actually being presented as consent.
Okay.
So when it was on the February 20th agenda, do I have that date right? It was posted as a consent item.
Okay.
And there are council members that we typically do not like for items of this nature to be consent. And we had discussions with those council members in particular to see if they had an issue with it being on consent, and they did not.
Good.
So we are all keeping our fingers crossed, doing good deeds, trying to be good people the next couple of weeks to hope that it stays on the consent agenda.
Thank you.
Thank you.
That's
Thank
it.
you, Manager Valdez.
Yeah, that would be nice because then it's done at,
Yes.
11:30-ish.
I understand.
So,
Okay. Anything else, members? All right. Well, I believe that we have arrived at item number 7.
I believe Stephen has some.
Oh, Stephen,
issues
sorry.
that-
Stephen, did you have something to add?
In
By the way,
closed session.
Stephen
In closed session.
Stephen
Okay,
and
so
Jeff,
I announce that the board is convening in closed session to discuss agenda item 6 under section 551.072 of the Texas Government Code, deliberation regarding real property. In addition to our Travis County Council, the following central health staff may remain for closed session: Mr. Giesland, Ms. Cavazos, Mr. Knodel, Ms. Owens, and Mr. Lamp virtually. Let's take a 5-minute break, members. Yeah.
I couldn't wait.
Yes. All right. So we have reached item 7, confirm the next regular board meeting date, time, and location. The next regularly scheduled Central Health Board of Managers meeting will be held on Wednesday, March 25th, 2020 at 5:30 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. Members?
I move adjournment.
Second.
There's a motion, a second by Manager Jones, Manager Valdez, second. All in favor? Aye. Opposed, same sign. Abstaining, none. We are
Thank you,
adjourned.
members.
Thank you all.